Today I'm going to talk about blood pressure and some mechanisms that the body uses to bring blood pressure back to homeostasis. So first of all, let's talk about the blood pressure equation, which is blood pressure equals cardiac output times total peripheral resistance. Now, cardiac output has its own equation, which is heart rate times stroke volume. Now, heart rate's measured in beats per minute, and stroke volume is measured in mils per beat. Now, on average, with a healthy person, we are talking about around about, on average, 70 beats per minute and about 70 milliliters per beat. Now, this gives us around about an average of 5 liters per minute of blood leaving the heart. Now, stroke volume has 3 separate things that influence it. First of all, we have venous compliance. Now, venous compliance is important because it's the willingness of the veins to put up with pressure. So if venous compliance goes up, the veins are going to expand or dilate, and they're going to allow more blood to pool. This helps when we're trying to drop the blood pressure. If venous compliance goes up, those veins are going to constrict, they're going to get smaller, and they're going to push blood in a healthy person back to the heart. And that's my next point, which is going to influence venous return. Now, venous return is the amount of blood that comes back to the heart from the veins, in this case the superior and inferior vena cava, back into the right atrium. And that's what venous return. So these two go hand in hand. So less venous compliance equals increased venous return. But the only circumstance that this would be, off would be if someone's dehydrated and they've got a lower blood volume than the normal person. The last influence is the contractility. So with contractility, we talk about the Frank-Starling mechanism. And the Frank-Starling mechanism is venous return brings blood back to the heart. Then we get it's called an end diastolic volume, which is the amount of blood that's in the heart just before the contraction of the ventricles. We have another term called preload. So that's the amount of pressure being put on the walls of the ventricle before the ventricles contract. So the more pressure on those ventricles, the more stretch. So if there's more blood in there, those ventricles are going to stretch more. Therefore, they're going to contract harder, and that's Frank-Starling's mechanism. So what he's saying is the more stretch on those on that ventricular myocardium, the more it's going to contract. Now, so there's 2 terms we used, which was end diastolic volume and preload. Now there's one more. The last one is afterload. And afterload is, so the blood comes in and it fills up just before contraction. That's end diastolic volume, and the preload is the stretch. Then we have afterload, and afterload is after the ventricles have contracted, they're going to push the blood through that aorta, and it's the amount of pressure that blood needs to push past to move into the aorta and throughout the body. So just think of it like if you had a hose and you put your finger over the edge of the hose, it's going to spurt out further and faster. and harder because it needs to push more pressure because it's a smaller opening. And that's the same with this. So people that have plaque in their arteries, like atherosclerosis, that kind of thing, we're going to need higher pressure to push that blood through. Now, if I come back over to the equation again, we're going to see here that if heart rate increases, cardiac output is going to increase, therefore blood pressure is going to increase. The same is if, say, for example, venous return increases, contractility increases, therefore stroke volume increases, cardiac output increases, blood pressure is going to increase as well. And it's the same if heart rate decreases, cardiac output decreases, blood pressure decreases. Now that's blood pressure explained. Now let's talk about the mechanisms that the body uses to bring it back to homeostasis. So first of all, we have these receptors in our aortic arch and our carotid sinuses. Now these receptors are called baroreceptors. Baroreceptors. Now these baroreceptors, baro meaning pressure, receptors, so pressure receptors, they pick up on how much the artery is stretching. So for example, if blood pressure is going to increase, there's going to be more stretch in those arteries. Therefore, there's going to be more signals getting sent to this part of the brainstem called the medulla. The medulla has a cardiovascular center which picks up on these signals and it works out how to, if we want to drop blood pressure, if we want to increase it, it works it all out. So say for example, blood pressure's increased. Say you're running to the bus, whatever, you're doing some exercise, your blood pressure's increasing. So there's more stretch in your aortic arch and in your coronary sinuses. Now, quick side note, the coronary sinuses are just before the bifurcation of the common carotid artery into the internal and external carotid artery. Anyway, back to it. Blood pressure is increasing for whatever reason. More stretch, more signals getting sent to the medulla. Now the medulla picks it up, and what it does is it inhibits the sympathetic nervous system. So the sympathetic nervous system is our fight or flight. So that's the one that's going to increase the heart rate, that's going to increase the blood pressure, increase cardiac output. We want to turn that off. So it turns it off. Then it sends via the vagus nerve or cranial nerve 10. It sends signals to the heart and it's going to release a neurotransmitter called acetylcholine. And that acetylcholine is going to slow the heart rate down. So like we spoke about over here, if heart rate slows down, cardiac output decreases, then blood pressure is going to decrease. So acetylcholine, it does a lot of stuff to cause the heart to contract slower. We'll talk about that in another video. But let's say the opposite. So say that blood pressure is decreasing for whatever reason. Say you get up too quickly and your blood pressure hits the floor. So what happens is the stretch in those arteries are going to decrease. Therefore, this medulla is going to pick up on that and it's going to be like, okay, so now we need to inhibit the parasympathetic nervous system or your rest and digest system. So it inhibits that and then it sends via the spinal sympathetic nerves. It sends signals via the spinal sympathetic nerves to the heart, releasing noradrenaline. This noradrenaline is going to allow for the heart to contract harder. It's going to increase heart rate, therefore it's going to increase cardiac output and increase blood pressure. So there's a couple of other things that noradrenaline does. Noradrenaline or norepinephrine in the USA. What it's going to do is going to act on the veins. So say we've got a vein over here. Now there's blood pooling in this vein. blood's pooling in this vein and we want to get more blood back to the heart so then we can make the heart contract harder. So what we're going to do, noradrenaline acts on the smooth muscle of the veins and it's going to cause them to constrict. Now, in a healthy person, if the veins constrict, it's going to push more blood back into the heart, right? It's going to push more blood back in the heart. So venous compliance is going to go down. Venous return is going to go up. Therefore, via Frank Starling mechanism, the contractility of the heart is going to go up. It's going to beat harder. Therefore, stroke volume is going to go up. So that's on that side. Heart rate is already going to go up because noradrenaline is going to be acting on the heart. Therefore, cardiac output is going to be going up. Therefore, blood pressure is going to be going up. So that's that mechanism. Now, I forgot to mention earlier that the vagus nerve is the nerve that is picking up those signals from the baroreceptors from the aortic arch. The coronary sinuses have a separate nerve, and that's the glossopharyngeal. Glossopharyngeal nerve, or cranial nerve 11. And the glossopharyngeal nerve, just sends those signals to the medulla. And that's everything. Thank you very much.